So to gain access to primary care and other specialists, it's most economical in most cases to get on healthcare insurance to access that ongoing care so you can live a healthier life.
Hi, everyone, and welcome to Hi-Fi Health News. I'm Erika Grotto. If you're one of the 25 million people in the U.S. without health insurance, this segment is for you because we're going to tell you how to get covered. Joining me today is Shawn Stack, a policy director at the Healthcare Financial Management Association. Shawn, let's say you just left a job. Your coverage at your new job doesn't start for a while. How do you get health insurance coverage in the meantime?
You have several options if you've just left your job and you're waiting for your next job's coverage to kick in, so to speak. You have the right, of course, to choose COBRA coverage, and I know you've done a segment on that. And that COBRA coverage, which allows you temporarily to continue your employer-sponsored health insurance after leaving your job, or if you've experienced a qualifying life event, that COBRA also kicks in. COBRA is intended as short-term extension of your existing health plan, helping you avoid gaps in coverage, though it's typically paid by you at full cost. Alternatively, you may choose to obtain coverage through the health insurance marketplace during this transition period. Certified navigators are available to help you compare options and select the plan that best meets your needs through the marketplace. You may also reach out to an insurance broker in your area to explore options through them that may fit your needs during this period of non-coverage or flex between jobs. So those are some alternative avenues where you can seek healthcare coverage in the meantime.
So let's take another scenario. Let's say you're self-employed, so you don't get health insurance through work. Is the marketplace your best bet there?
First, I would recommend for those who are moving into self-employment, if you have an employed spouse, check to see if it's beneficial for you to be added to your spouse's healthcare benefits through their employer. If this is not an option for you, again, explore the healthcare coverage through the Marketplace exchange and contact a navigator to assist you if you need assistance finding the coverage and plan that suits your needs, both healthcare needs and financial needs. Also, depending on your household income, resources, you may also be eligible for Medicaid during that period of flex. The Marketplace Exchange will explore this option for you before they refer you to one of the managed care plans on the Marketplace as well. They'll look at your state Medicaid programs and see if you're eligible for any of those based on those benefits and requirements of seeking Medicaid through your state.
Okay, so let's talk about Medicaid for a second. If you have limited resources, you don't have an employed spouse, you don't have a job that gives you health insurance, is Medicaid your only option? What are some other things you want to look into?
Yeah, Erika, that's a great question. Medicare actually is not your the only course and the only option that you have for folks with limited income and resources. And if you don't qualify for Medicaid coverage in your state, there are other resources that you can access to find healthcare coverage that would be right for you. Again, I sound like a broken record here, but the Marketplace Exchange can be a great resource. And there is currently premium assistance for limited income individuals who apply for coverage through the Marketplace. Also, if you are if you're someone who is disabled or partially disabled, you may be able to find that Medicare or Social Security disability could be a resource for you. And you could go there and talk to someone at Medicare or Social Security disability and find out if medical coverage can be offered through the Disabilities Act.
Now, I want to get into financial assistance a little bit. We've talked about that here before. There are options for you when you go to get care. Do you still need to go get that coverage?
That's a great question, Erika. And I think that's a rabbit hole that a lot of patients in particular that have high medical bills or have medical bills and seek financial assistance don't understand what that financial assistance really is. So financial assistance is appropriately named financial assistance for a reason. It's not healthcare coverage. And while financial assistance can help cover hospital medical bills, it does not provide you with healthcare coverage to see doctors on a regular maintenance basis. And that is what you really want to lead a healthier life. So to gain access to primary care and other specialists you may need, it's most economical in most cases to get on healthcare insurance to access that ongoing care so you can live a healthier life.
So getting that coverage is definitely a great idea, but if you still need financial assistance with that health insurance, be sure to ask your hospital about your options. I'm Erika Grotto for Hi-Fi Health News. Thanks for watching.